Good morning, everybody. I'm Major Renda from Humana, Director of Population Health. Really excited that we're talking about food insecurity today. I'm going to tell you a little bit about Humana's journey on how we got to addressing food insecurity and a little bit about our pipeline of what we're doing. So this all started for us back in 2014 when our CEO, Bruce Broussard, declared what has become known as our bold goal. And our bold goal is to improve the health of the communities we serve by 20%. And so then he looked at my team and said, okay, figure out how we're going to measure that. So we looked at a lot of different health-related quality of life measures, and we settled on the CDC, the other CDC, Centers of Disease Control and Prevention, Healthy Days tool. And we really like that because it's a short, simple tool that I'm happy to talk about later. But it gives equal weight to physical health and to mental health. We really like that measure, and so we keyed on that. And so our objective is to improve the health of these communities by 20% measured through the Healthy Days tool. And the short and simple methodology of how we do this is we convene within communities, all the local stakeholders, for-profits, nonprofits, faith-based, governmental organizations, and really try to figure out what are the things that are driving or preventing health in a community, chronic conditions, and social determinants. And what we're really trying to do is address those social determinants, going direct to the patient and also going through the primary care provider. And ultimately, we want to improve health outcomes and give back more healthy days. So we took this Healthy Days tool and we said, okay, so we got to improve it by 20%. We believe that we can do that through addressing chronic conditions. But we also recognize that we need to go upstream and deal with social determinants of health. And so we did some preliminary research, and one paper that I'll talk about really briefly is that we took a data set from the Robert Wood Johnson Foundation from their County Health Rankings report and combined it with our data on Healthy Days and looked at if you improved a single social determinant from the 25th percentile to the 75th percentile relative to all the other counties in the country, what would the improvement be in health-related quality of life? And when we did that, loneliness was the number one opportunity. And the number two opportunity was food insecurity. And so that's really how we've honed our focus to just those two social determinants and developed intervention pipelines to go along with it. And this is our intervention pipeline. So it started with research, figure out, what are all the associations between food insecurity and health outcomes and conditions. And then we just began to test and learn. We tested, could we screen and refer around food insecurity in physician offices? And the answer was yes to that. And so we developed a toolkit that we can offer to any physician to educate them on why it's important, how to screen, which validated survey tool to use. We use the USDA Hunger Vital Signs 2-question questionnaire, and how to have that empathic conversation and address it and refer to appropriate resources. From there, we said we really need to get to those proof points that my other panelists have mentioned already, and so we initiated a randomized control trial, really looking at a high-touch intervention where we took people who were food insecure and gave them food. We connected them to resources. We enrolled them in SNAP benefits. We did case management, and we're going to look at, does that improve outcomes in 3 categories: health-related quality of life, clinical outcomes, and financial, meaning reductions in utilization and cost. And so from there, we also recognize that sometimes we don't have the opportunity to ask everybody if they're food insecure. And so we want to use, advanced analytics, predictive models. And so we developed a predictive model for food insecurity where we can run it against our entire Medicare or Medicaid population and find out who's likely to be food insecure and then target them specifically with resources and tools, et cetera. We've also looked to integrate social determinant screening, food insecurity, into a lot of our current clinical operating models, so where we do disease management, telephonic, in-home, et cetera. And that's how we got to the 500,000 screenings that the Assistant Secretary mentioned this morning. We're also looking at, as we're able, as benefits, supplemental benefits on Medicare and Medicaid plans are evolving with value-based insurance design, or VBID, or SSBCI, which is social determinants tied to chronic conditions. We're experimenting in that space as well. And so we're really excited about the opportunities. And, like others have said, not everything's going to work, but we have to start somewhere. We have to test and learn. And what does work, we need to scale. And 2 other things that I'll talk about quickly. We talked earlier today about tying social determinants to clinical quality measures. I think that's absolutely something that we should do. And it's a yes and. We should also actually codify social determinants as clinical gaps in care and create quality measures around them. And so we're doing some work with the National Quality Forum to do just that. So treat them like clinical quality measures with there's initial screening, there's intervention, and there's outcome. And so we're taking that approach with food insecurity. We're going to establish these metrics, and then we can benchmark physicians, we can tie codes to them, we can tie value-based payment models, et cetera, et cetera. So big opportunities on the quality measures. And the last thing is, we developed this tool. There's other tools out there, but I believe that, again, leveraging data and analytics, this is a heat mapping data visualization tool for social determinants. And so we're able to take a lot of publicly available data sets from census data, from Robert Wood Johnson, CDC, 500 cities, all sorts of places, and put this into this one tool. And so you can heat map things like food deserts. But it also has a community resource directory in there, so you can also overlay food banks and grocery stores and transportation options. So if you plug in an address and you see where someone lives in a food desert, you can connect them to public transport. You can tell them where the nearest food bank is. Lots of really good opportunities there as well. So I just wanted to highlight that there is power in data and analytics that we can leverage on social determinants. And I think that's it for me.